I'm Dr. Sri Banerjee, epidemiologist, biostatistician. Hello, everyone. I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And in this segment, I'm going to be going over a concept that most people don't know about, that is telemental health services. County health rankings and roadmaps is a very important tool in public health, and it's important to understand all of these different telemedicine types of services. Initially, when I came across this term, I had no idea what this meant, but County Health provided a definition. I wanted to share with you some of the definitions that telemental health includes. So, mental health care services over the telephone or video conferencing technology is telemental health. Personally, I've used this on the patient side for seeking mental health. So this is also known as telepsychiatry or telepsychology. This can include psychotherapy, counseling, supplemental support services accompanying in-person therapy, such as medication management. So these are the services that you can use through telemental health. And with the COVID-19 pandemic, this became more and more in vogue due to the risk of transmission. Online CBT, cognitive behavioral therapy, is also considered telemental health. Also, patients can receive care on the personal device via a service which uses a secure platform or be hosted at clinics or hospitals with telemedicine equipment. So direct real-time services or synchronous services are the most common, and they're generally provided by psychiatrists, clinical psychologists, clinical social workers, and psychiatric nurse practitioners. So this is, in fact, a very broad umbrella sort of practice that is important to know about. Also, CBT can be self-directed services, may or may not involve direct interaction. This is especially important in rural communities or health professional shortage areas and in emergency situations such as disasters. Some of the benefits is improved mental health, reduced PTSD, and increased access to mental health. Potential benefits is reduced suicide, reduced vehicle miles traveled, and reduced emissions. So even though they're talking about rural areas, even within the city, there are many hurdles to get from place of residence to, say, taking services. So, for instance, a person that lives in a certain area, due to lack of cars or personal transportation, telemedicine can benefit in those situations as well. So initially, and I personally know about this because when I went to medical school, this was something that we used. So traumatic injuries, these are all connected specialist providers, such as clinicians treating for patients in emergency transport departments. So before March 2020 and the onset, like I was talking about COVID-19, provider-patient telemedicine use was for increasing, but was a tiny proportion of overall care. So the VA hospital purchased access if their healthcare provider offered direct-to-consumer services. So this is also used for household income, disabilities, and older adults. So in essence, telemedicine and telemental health is a very useful, powerful tool that can be used in many different scenarios. I hope this has made some sense. Thank you for listening.